let's move into talking about what their language might look like, a person with autism and their literacy skills. Their early language and communication development, it's difficult sometimes to collect data. Autism is typically diagnosed past age 2, and like I had just mentioned previously, a lot of times one of the first symptoms is that it's a regression in some kind of development that has the parent concerned or the pediatric doctor concerned enough to refer them on. Research has shown that children with ASD are going to be less likely to look at people. They're less likely to look at an object held by another person, to answer when their name is called, to use kind of those hand gestures, that body language when they're communicating, to share joint attention, and they have poor receptive language, meaning difficulty understanding directions and things like that. Joint attention would be kind of those top things we're talking about. When a 2-year-old walks up to you with a toy and says, like, look, and they're like they want to show you their new toy, that's joint attention. They bring it to you, they're expecting you to look at it and you like share that moment. That's joint attention. That's severely lacking in children with autism. Now, looking at those areas, we're always going to look at in the specific language domains. In phonology, they have considerable trouble with suprasegmental features. This would be stress and intonation, is a very recognizable, difference in this population. They might talk very monotone. They might use some very weird stress patterns. I've had lots of kids that talk like that. So it's just atypical in all kinds of different ways. They have difficulty with pronouns, expressive grammar. The big one here is understanding figurative language. So expressions, idioms. That's what it's talking about here, going into not only how it relates to grammar, but vocabulary, semantics. Any type of use of non-literal language is really, really hard. Like when you say it's raining cats and dogs, a child that's on the spectrum that needs a considerable level of support, they might think, oh my gosh, there are cats and dogs falling from the sky. There's no understanding that that's an expression we use to say it's raining really hard. Pragmatics, this is the big area socially. Most aspects of a speech act, like listening, politeness, staying on topic, not using irrelevant statements, just their conversational skills in general really suffer. And then another very large, another large area that you see, still not the word I want, but another, darn it, I'm having a communication difficulty myself. Anyway, another big thing you'll see in this population is echolalia, when they just repeat. They might just repeat you. It's very common for them to kind of repeat one of their favorite cartoons or one of their favorite songs. Like they just over and over and over and over, or they just say the same sentence over and over and over and over. Not necessarily repeating you, but sometimes they will. So they have this kind of rote script that they'll say, but they also will repeat you a lot when you ask a question. So if I were to say, what is your name? They might say, what is your name? Instead of answering the question. It's a very common characteristic, again, if that's the right word, of ASD is echolalia. Some factors that are related to language and communication disorders in this population would be parental responsiveness. Again, so we're not saying it's entirely on them because it's not, but we do know there's always a level of that responsiveness to early play interactions to have better language for any child. Their cognition, there are different intelligences associated with autism. There are people that also have intellectual disability, very low cognitive functioning, and then there are people that are on the autism spectrum that are brilliant, that are, IQ 140 and above. And so it's such a wide, that's why this is such an interesting disorder, because there's such a wide variance But there is a close relationship between cognition and language, just like with typically developing peers. So those students that are on the spectrum that have a typical IQ or above are probably going to have better language. Their socialization, it depends on how difficult joint attention is, how difficult imaginative play is. I've worked with kindergartners with ASD in the classroom who are working more on just social things and can kind of hang with the academics and have joint attention to where you can do therapy. And then I've worked with kindergartners on the autism spectrum who have no joint attention, where the whole session is just spent trying to get on this very basic skill that most infants have by like 6 months. And so it's a huge factor because without that joint attention, any language learning is difficult. And then the neurological factors. We believe that there's a literal brain difference in a person with autism and a typically developing person. And so they believe that there's a slightly larger left hemisphere in a neurotypical person. And so they're saying that could account for these language issues because if a person is born with a slightly smaller language area, this left hemisphere of their brain, could that contribute to their language struggles in all the areas, including socially? It's just still a theory at this point. When we're talking about literacy and autism, there are significant cognitive and language delays. And so, if they have significant cognitive and language delays, it makes sense that their reading and writing would also have significant delay or error. And then, if they have just mild cognitive and language delays, then they might be able to acquire those literacy skills similar to a typically developing peer. And it just depends if we can combine emergent literacy with intensive use of technology versus using the readiness model. But there is definitely more than just how is a child with autism going to read and write or how's their literacy going to be. You're still looking at their language and their cognition. And since that varies across ASD, you could never look at a child on your caseload with autism and assume you know where they're going to be because it's going to take a lot more than just an autism diagnosis, right? You have to know their IQ and kind of their language to see what you can expect of their literacy skills. They had some suggestions, though, in your book about teaching literacy to anybody on this spectrum. And they're listed here. You always want to provide sufficient time for the instruction. I mean, these things are pretty common to all teaching, but use an appropriate instructional content, using appropriate instructional procedures, using adaptations to allow active participation. So this would be with those kids specifically who might have an AAC device. So some students with ASD are nonverbal and use an AAC device to communicate. So we want to make sure we plan that. And then we have to establish positive rapport, and maybe more important than anything is that bottom part that says, and motivating instruction. They have to be highly motivated and reinforced in order to understand the value of what you're trying to teach them. And then once they get it, they take off from there a lot of times. But finding motivating instruction, i.e., finding what is reinforcing to each student with autism, is extremely important in teaching them. Some more suggestions just from a different study is recognizing all literacies, again, not making any assumptions about what they can do just from having an ASD diagnosis. Use their interests. That's what I was talking about with motivating and finding out what's reinforcing. We cannot assume we know that they are reinforced by the same thing all the other kids in your classroom are, especially like a lot of times something we use is social praise, right? These systems where you get that thumbs up or that sticker or that wink from the teacher, and that does a lot for many students, not so much for kids with autism. And we need to use a wide range of visual supports. This is a huge area. Individuals with autism are highly visual. Remember, I was saying they have a hard time with receptive language, understanding spoken language. So if we can show them, they respond so much better, whether that's a schedule or directions Visual supports are a huge, huge part of any intervention for a student with ASD. Reading aloud, and then using and encouraging different types of expression. So you're modeling it and then asking them to imitate it, giving them that practice. Moving into specific interventions for language and communication impairments in this area. We talked about this in a previous lecture, but it's very common for this principle of applied behavior analysis, discrete trial training, to be used. There's actually a point in like the 90s when this is what like they thought the only thing that should be used. Like, let's put this kid for multiple hours a day into this kind of very rote discrete trial training task. And that's what's going to really help a child with autism. And there's some truth to that, but we know that that's not the only way. It is a very powerful intervention tool for this population, though. So it's mass trials that are initiated by adults through this ABC chain, this antecedent, behavior, and consequence. Antecedent is what comes before the behavior, the actual behavior, and then the consequence, what happens when they perform that behavior. So a teacher provides a stimulus, waits for the response, rewards correct response. So stimulus, antecedent, child response is the behavior, the consequence is the reward. And this is based on a principle of operant conditioning. So you have to figure out a very discrete intervention target. So we're not going to focus on a broad skill, but a very narrow skill. And then you're going to use positive reinforcement to provoke that desired response. This video can explain it so much better than I can and give you an example. So I want you to watch this so you can learn about this really powerful method for several reasons in case you want to use it in your instruction. You know, if a child in your class has outside services, most likely that family or caregiver is going to say, hey, what about ABA? What about discrete trial training, otherwise known as DTT? So I want you to be familiar with this approach because it's very commonly used, and I firmly believe you'll hear about it again.